want to turn now to Dr. Ashish Jha, a public health expert who serves as a senior fellow at Harvard University's Kennedy School. Dr. Jha, it's good to see you. You know, the early indications were that this was not a virus that spreads very easily human to human. We talked about that last week. Now it's looking like perhaps the spread is a little more contagious than we thought. How concerning is that?
Good morning. And first of all, thanks for having me back. Look, we've never had an Andes strain of an outbreak in the U.S. before. All of the literature suggests that it's very hard to spread, but based on relatively few studies. What we're hearing now, including from the doctors who are on the ship, is that at least a few people contracted it without that sort of prolonged close exposure that we've always assumed. So my view is this is still extremely containable. We should be able to get this under control, but we've really got to pay very close attention to every patient and make sure that they're all being monitored and quarantined appropriately.
Dr. Jha, do we know at this point whether someone who's asymptomatic can actually pass the virus to another person?
It's a great question, Craig. So look, the literature suggests that you have to have symptoms first, but the literature is thin just because we haven't had that many outbreaks of this virus. My working assumption still is that it's going to be symptomatic people who are going to spread it, but we shouldn't assume that. We should basically be monitoring every single one of these patients who are people who've come off of the ship and making sure that they go through a quarantine and that they're being tested regularly, both symptoms and blood tests, to answer the question that you were raising, Craig.
They say that the symptoms can appear anywhere from, I don't know, a few days to 6 weeks. So are you suggesting that these passengers who return to the U.S. should be in quarantine for 6 weeks?
Look, I want to get this outbreak under control and done with. I do not want to see more spread to other people. I think the safest way to do that is what, for instance, Spain is doing. Spain is putting all of the people who came off the ship on a 6-week quarantine. I think that's probably it is the safest route moving forward. And that's what I think we should do, partly because we don't have full understanding of the transmission dynamics of this virus. And we should, I think, at this point, err on the side of caution and really work to get this under control.
Yeah. Well, we know what happens when that doesn't happen, so we don't want to see that again. Dr. Jha, thank you very much. Appreciate it.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.